Good afternoon, and welcome to this week's live town hall focused on ensuring your public health services in Douglas County. My name is Erica, your moderator on the call. This week, we'll focus on sharing information with the residents of Douglas County about the next steps in the continued delivery of public health services to Douglas County. Your Douglas County Commissioners, Roger Partridge, Laura Thomas, and Abe Layton are live and ready to share updates and address the many comments and questions received in the past week. Also joining on the phone is Dr. John Douglas from the Tri-County Health Department. Please press *3 on your phone keypad at any time to ask a question. In the last 6 days, the board has received hundreds of comments and questions regarding the decisions made last week to opt out of the Tri-County Health Department's mask mandate and to direct the staff to begin taking steps to create a separate public health department for Douglas County. We will begin tonight with the board and Dr. Douglas addressing many of the questions received from residents during this past week. If time allows, we'll also take questions from the participants on this call. To ask a question, you can press *3 on your phone or send your question through the website at douglas.co.us/townhall. Dr. Douglas, we'll get started by hearing from you first. The governor mentioned yesterday that he will not do a mask mandate in the state because there's no evidence that mask mandates improve mask wearing. Can you share your thoughts on that and any other updates you have? Go ahead.
Sure, Erica. Thanks for that question. I didn't get to hear the governor yesterday, so I don't know exactly what he said. I will say that there is, I would agree, limited information about the impact of mandates, but there is not zero information. There was an important study published last month in the Journal of Health Affairs that was part of our Board of Health discussion. The title was Community Use of Face Masks in COVID-19, Evidence from a Natural Experiment of State Mandates in the U.S. And this study looked at the experience in 15 states plus Washington, D.C. In terms of what happened before and after they initiated the mandate. So it's not a comparison between states who did and did not, but rather a pre-post. And what they saw was that after the mandate was issued, the wearing of mask coverings increased, and more importantly, really, there was a decline in the daily COVID growth rate. By 21 days after the signing of the mandate, there was a daily 2 percentage point reduction, which is actually quite impressive. That data was used shortly thereafter by Goldman Sachs, who did an economic analysis for their those who received their newsletters. Really quite an in-depth look at the impact of mask mandates. And in that analysis, they made the assumption that if mandates worked as well as they had in that one policy analysis, it could reduce the need for businesses not to be open to the tune of enhancing gross domestic product by 5% nationally. This is a national mandate. So again, limited information, but pretty powerful, since policy analyses like this are tough to do. And again, a pretty respected analysis by Goldman Sachs suggesting a pretty impressive economic benefit of that mandate.
Wonderful. Thank you, Dr. Douglas. Now let's get to the questions and comments that have been submitted recently. All right, this first question is for you, Dr. Douglas, and they are asking, Douglas County opted out of the Tri-County mask mandate last week, saying that 75% of our community already is in compliance with the mask mandate. How did you arrive at the 75%? Can you tell me what it is today, and what can I do? What can we all do to help improve this percentage?
So thank you for that. Yeah, we've actually tried to monitor the wearing of masks as best we can. This is direct observational data. Most of what exists right now is survey data, asking people to respond. Do you wear a mask? Sometimes, most of the time, all the time, this kind of thing. We've got a number of volunteers across our 3 counties who are going to large stores throughout the region, basically sitting in the parking lot with a clipboard and just monitoring what's happening when people walk in and out. And Douglas County does have, I think it's fair to say, quite good rates when our Board of Health meeting took place, the percent then was 74%. The most recent day that week we collected data last week, it was 80%. That's probably not a statistically different measure. It's been varying between 75 and 80%, but it has pretty consistently since we started doing this in early June come in at about that level, and that's the methodology by which we do it.
Wonderful. Thank you so much, Dr. Douglas. This next question is for Commissioner Roger Partridge. They say, our family doesn't want Douglas County to cut ties with the Tri-County Health Department. We believe in science. We want opening requirements mandated by scientific medical experts, aka doctors. We want our family to be safe when we must go somewhere like the grocery store. And they would just like your thoughts on that. Go ahead, Roger.
Erica, thank you for that. And if it's okay with you, I will like to have Commissioner Layton answer this question.
No problem. And thank you, Commissioner Partridge. And just to step back, I really want to extend our thanks on behalf of the board to Tri-County Health. We are dealing with consummate professionals with a high level of public health expertise that we have an incredibly high level of respect for. So tremendous thanks to Dr. Douglas, as well as Melissa Sager and all of the folks over at Tri-County Health. They've been absolutely incredible to work with. That question's important because the reality is, I'll tell you, for my family and for me, I wear a mask. This is my mask right here. My family wears a mask. I encourage everyone in the county to wear a mask based upon the guidelines and the recommendations of the public health experts. Elected officials are not public health experts by and large. And so I think it's important to be driven by the data and to be driven by the science. But we need to make an important distinction between a strong recommendation to wear a mask based on science, which I certainly support, and I think many others do, and the idea of a mask mandate, where, as we're seeing in other counties and other municipalities, there could be a fine up to $1,000 or more and potential jail time. So from our perspective, we're looking at a county that has 80% compliance with mask wearing all on its own without a mandate, 80%. And that's not my statistic, that's Tri-County Health statistic. And we just heard that from Dr. Douglas and others. So based on that information and the good data that we've received about COVID-19 in Douglas County, thanks to the hard work of our citizens, we did not feel that a mandate for our citizens was appropriate. And our understanding is that that was the recommendation from Dr. Douglas to the Board of Health. And unfortunately, when that did not occur, it was an eye-opener for us in terms of what might be best going forward. But it doesn't change the fact that we do have the highest level of respect for Tri-County Health, the professionals. They don't just deal with COVID-19. There are a whole host of public health services that they provide to our citizens and those in Adams and Arapahoe. And I think it's important to acknowledge all the hard work that they have done and hopefully will continue to do. Let me also indicate that nothing is changing today. So as of right now, we still have a relationship with Tri-County Health. Tri-County Health is still the public health department in Douglas County. The only thing that has changed is we've provided them 1 year's notice that we are intending to make a modification to have our own health department, but we've got up to a year to do that. So right now, no change in terms of cost, no change in terms of personnel. Everything is remaining the same. So it should be relatively seamless for our citizens. But thank you so much for the question. Thank you, Erica.
Wonderful. Thank you, Commissioner. Now, our next question is for Dr. Douglas. They would like to ask, what would be the evidence of a spike in COVID-19 cases in Douglas County? If there is a spike, what is the plan to mitigate it? Go ahead, Doctor.
So good question, because in fact, across the nation, across Colorado, and even in Douglas County now, we are seeing incidence rates go up. We don't have a formal tri-county threshold, although the state health department does have a threshold that when cases cross 100 cases per 100,000 over a 14-day period. And we calculate that on a daily basis at Tri-County for all 3 of our counties, then the county needs to either introduce a mitigation plan or to begin to reduce some of the capacity in their variances. So Douglas County's incidence right now is at about 75 per 100,000, which is higher than it has been. In fact, the incidence rate in Douglas County is now going up faster than any of our other 3 counties. I'm hopeful that this will not persist. I believe that this is in large part due to testing, and I'm happy to note that the test positivity rate in Douglas County remains below another cutoff, 5%. When you begin to get more than 5% positive, then you begin to think you may have some increased transmission going on. If we were to cross that, and if the test positivity were to increase, we'd be working with commissioners and others in the county to figure out what would make the most sense. We would certainly want to be doing everything we could to encourage masking. We'd want to be doing everything we could to discourage large gatherings of folks. We've seen that happen in some of the Sun Belt states. We'd want to be looking at opportunities if there are places that are really allowing gatherings without social distancing to happen, to educate those, or if they're really honestly out of compliance with the current guidelines, to have them close until they can come back into compliance. Those are among the things that we would be entertaining. By the way, we also are aggressively trying to increase our contact notification work, and Douglas County's been supporting us in that. So we'd want to really be pushing hard on that. So I think those are the kind of things we'd be wanting to do. And ideally, we want to do that in cooperation with the community. Let's be blunt, there has been some reaction to some of the public health recommendations. I'm delighted that Commissioner Layton and his family promote mask wearing. And I think the more we can be messaging that really across the county, I think that 80% rate could get even better, because it's good, but even better could help if we begin to go higher. So those are some of the things we'd be thinking about.
All right, wonderful. Thank you, Dr. Douglas. Our next question is for Commissioner Thomas. I'm going to go ahead and read the first part here. The commissioners have decided to withdraw from Tri-County Health and form their own county health department. Can you explain why this was done and how much will be budgeted for this new department? Thank you.
Thank you for that question. And it's clear from the emails and phone calls we've been getting that we have not done a good job messaging why we voted last Thursday to separate, actually to serve a notice to Tri-County Health, that we are giving them a 1 year's notice that we are going to be creating our own public health department. The reason for this has nothing to do with the actual mandate of masks. The reason for this is the Board of Health that directs the activities of Dr. Douglas. So the Board of Health is comprised of 3 people from Adams, Arapahoe, and Douglas counties. And those 9 unelected appointed people make policy decisions that Dr. Douglas implements. Last Wednesday, Dr. Douglas recommended that Board of Health implement a mandatory masking order for Aurora and Adams County. And for Arapahoe County, they could either opt in or opt out of the masking order, and Douglas County would have the ability to opt in. But during that meeting, a representative from Adams County made the motion that all 3 counties would be masked up. Now, this was not in compliance with the recommendation of the expert in the room, and that motion passed on a 5-4 vote. There is one doctor on that Board of Health, Dr. Tom Faywell from Arapahoe County. He also voted no on this motion. And our concern is that we just cannot allow the critical decisions that affect the liberties, freedoms, and livelihoods of Douglas County citizens to be left in the hands of unelected appointees. So in this case, the Board of Health made a decision that wasn't necessary for Douglas County citizens. And we cannot have our citizens in a position where this happens again. And that is the reason that we have notified Tri-County Health that we are going to create our own health department. Now, there's questions about the cost, and we don't know what that cost is. We currently spend $2.5 million a year contracting services from Tri-County Health, and I believe their budget is around $44 million. Our hope is that we can come to a resolution with Tri-County Health that they will continue to provide our services for our citizens, but there will be a different Board of Health in place, a Board of Health that is comprised of Douglas County residents who will be directing the future health needs of Douglas County residents as well. Thank you for that question.
Wonderful. Thank you, Commissioner. All right, our next question is for Dr. Douglas. They wrote in, does the Douglas County opt-out of mask requirement by Tri-County Health Department supersede a city, Inglewood, decision to require wearing masks, or does the county opt-out apply only to those parts of the county that are unincorporated?
It's a really good question because I think this can be really confusing in fact because different jurisdictions may decide things different ways. There is likely to be some confusion, if not a frank patchwork. It's our understanding from advice from our attorneys that the counties, and we've got 3 experts with our elected commissioners here, have jurisdiction over the unincorporated parts of the counties, but that a town would have jurisdiction over its own incorporated settings. I believe Inglewood is largely, if not exclusively, in Arapahoe County. They did, by the way, pass their own ordinance before our board even met. They have indicated that they will probably rescind their ordinance in lieu of the one that Tri-County issued. And I do believe that in their setting, they've got the authority to do that for their city, no matter what the Arapahoe County commissioners decide.
Wonderful. Thank you, Dr. Douglas. Let's go ahead and take a break from our online questions, and let's go to a live caller. This is for Dr. Douglas. We have Beth in Parker. Beth, you are live. Go ahead and ask your question.
Yeah, my question with the masks and stuff is there are people with medical conditions. When this started up, for my son and myself, we got notes from our doctors. I have a tendency to faint when wearing a mask. We found this out over 17 years ago, and my son has seizures. We carry notes from our doctors so that we can show people if they ask, but the problem is that a lot of these mandates that are coming out and stuff do not really address the people who are disabled, who have medical conditions, and how people should handle it. Some businesses are very nice, some are not. People in general on the street are not nice, and given these mandates, it's very hurtful because we're trying to follow what's being said, but also be polite and respectful because we have safety and medical issues that this mandate it does not work. How do you address that to help the people who are disabled to not be bullied or people look at them like they're doing something or denied service just because they're not doing something that they think everyone has to do?
Beth, that's really, really an important question. First of all, I will say that legally speaking, I'm not aware of any mandate, certainly not ours nor the others I've looked at from around the state, that require an individual with a medical condition or a behavioral health condition or other disability to wear a mask. So from a strictly legal perspective, again, I don't know of any, and again, certainly not the one we've put together, that would require people in the circumstances you described to wear a mask. Secondly, I'm also not aware of businesses, many of whom have their own policies. Walmart just announced this morning a national policy that all their stores would require masks in patrons. I'm not aware of businesses that don't allow those exceptions as well. Now, having said that, I will completely acknowledge that the issue of mask wearing has gotten hyper politicized on both sides. And you've experienced a situation where you're being ostracized or, in some way made to feel bad or like you're violating other people's space. And that's really an issue. You can't walk around with a sign on your neck that says, "Here's my medical excuse." And I think and of course we've got it the other way around, where we've got folks that are unhappy with being asked to wear a mask even in stores, and we've had store clerks on the front lines that have been harmed. We had a shooting in Aurora about this sort of thing. And honestly, I think what we need to do is to calm this whole thing down. Masks are important. For people who cannot wear masks, they should not be worn. And all of us, whether it's me yelling at somebody not wearing a mask or somebody yelling at me because I am wearing a mask, and both of those things are happening, I think all of us in leadership positions have got to seek opportunities to dial the rhetoric down. So I just want to reassure you that if you happen to be in a jurisdiction where a mask mandate is in place in Colorado, you should not be required to wear a mask. And hopefully that better education and learning we're all in the same boat together will help both people like you not be picked on, as well as helping all of us to sort of optimize mask wearing as much as possible.
Wonderful. Thank you, Doctor. And we have another live question for you. This is Rachel. Rachel's in Castle Rock. Go ahead, Rachel. Ask your question live.
Hi there. Thanks for taking my call. My question is, we tend to focus on there's an uptick because there's more cases. However, it seems like the most important thing is there an uptick in hospitalization? Because when this all started, it was all about not overrunning the healthcare system, and we successfully did that, and that's great. So I'm wondering what are Douglas County Commissioners and the Health Department doing to keep the focus on, is there an uptick in hospitalization? Because there's more testing, and we are out and about more. So, of course, there's going to be more cases.
Well, I'll take a shot at it, Rachel. Thanks, because I think that's a critical question. We monitor the hospitalizations really aggressively. We've got on our website daily updates on that. And right now, you're absolutely correct. We have not seen an increase in hospitalizations in Douglas County. We've seen a little bit of an uptick. Sorry, uptick's kind of not a statistically precise word, but in Adams and Arapahoe County, and Colorado has also reported that. Now, it may well be that the increase in cases in Douglas County due to increased testing, as you point out, is only going to be an increase in cases and not in hospitalizations and people getting sick, and that's really good. I would say that where we stand right now in our three counties may go on to be just what you're suggesting might happen, and I certainly hope it does. Or our curve doesn't look a whole lot different than Texas, Arizona, Florida looked a couple of weeks after Memorial Day. Now we're different. We've got a better outdoor climate. And frankly, Douglas County has a lot of advantages. We have fewer people in Douglas County working in essential industries where they've got to be on the front lines. They've got to be serving people face to face. We have, better housing stock. People can be spread out. So I think Douglas County has a lot of natural advantages. But it is by no means out of the question that kind of increase in hospitalizations and even ICU surge could happen, which is why we try to monitor incidents and hospitalizations and be prepared to introduce measures to try to curb that if it happens. I'll mention one other caveat. You don't have to have people in the hospitals if you have rapid community spread to impact the reopening of our schools. When we begin to get more spread in the schools and we have classrooms with infected people in them, those classrooms will, under state guidance and frankly under public health rationality, need to be quarantined for 2 weeks. And if you begin to get that happening in too many classrooms in your schools, or with too many bus drivers taking the kids to school, or too many teachers getting sick, even if the hospital rate doesn't go up very much, we're going to have a real problem doing what at least many of us think is one of the biggest challenges and most important things we can do. So hospitalization is hugely important. It could change, but even if it doesn't, it's not the whole story.
All right, thank you. And our next question is a live caller for you as well, Dr. Douglas. This is Koji in Inglewood. Koji, you're live. Go ahead and ask your question.
Oh, hi, Dr. Douglas. So I guess my primary question is this. With this concern, great segue, around the infection rate around students potentially causing an increase in the second wave, is there a reason why a mask mandate for middle schoolers and older is not being enacted? Not like mandate as in a fine or anything like that, but a requirement for them.
Well, in the jurisdictions who choose to opt into our order, Koji, they would be required to wear masks. The school districts are taking various approaches, although the ones that I've looked at guidance so far are going to be requiring masks for kids 6th grade and older. That's true in Cherry Creek. That's true in Douglas County schools. That's consistent with guidance that the local public health directors across the metro region, we've got a group called the Metro Denver Partnership for Health, put together 3 weeks ago, because the state's guidance, which we think is going to come out any day now, updated guidance, had not been finalized at that point. So we're learning a vast amount about kids and transmission. Younger kids don't seem to transmit nearly as readily. Once you get to be 10, 11, 12, you do seem to transmit more like an adult. And the use of masks, really in a mandatory way, with allowances made, honestly, for kids who can't wear masks, behaviorally or medically, we think is going to be really important. I think our schools have adopted that strategy as well.
All right, wonderful. Thank you. We're going to go ahead and go back to some of our online questions. This one's more of a comment, but this is Commissioner Thomas, if you would like to comment on that. They said, regarding your decision to leave Tri-County, I just want to thank the commissioners for using rational thought and making decisions in the best interest of Douglas County citizens. Having the health department directly part of the county is a good decision. Thank you. And if you wanted to comment on that, Commissioner.
I will make a quick comment. You know, when we joined Tri-County in 1966, the population of Douglas County was about 5,000. We're now 370,000. And these conversations about having our own something aren't new. In fact, this year, the legislature created Judicial District 23. We have been in Douglas County part of the 18th Judicial District since the 60s as well. That's Arapahoe, Douglas, Elbert, and Lincoln. This year, the legislature voted to leave the 18th Judicial District as just Arapahoe. Douglas, Elbert, and Lincoln will become Judicial District 23. Last year, there was also a concern at Dr. Cog, the Denver Regional Council of Governments. That's the organization that a lot of federal money comes through for roads. And there was concern about how that money wasn't being split up evenly either. And there was a new decision that was made that involved the sub-regional plan. So I think these are just part of the growing pains that happen, that Douglas County isn't a toddler anymore. We're an adult, and it's time that we were able to provide our own services. And when you look at a map of the counties across the state, a majority of them have their own standalone health departments. So Douglas County deciding to have its own health department really isn't that unusual, and I think it's actually overdue. So thank you for that great question.
Wonderful. Thank you, Commissioner. And our next question is for Dr. Douglas. We have Wilma live in Castle Rock. Wilma, go ahead and ask your question.
What is the value of being tested? I would think if I was positive, I would get it anyway. So I'm wondering, why do they do it?
Well, testing's a important and frankly, I think not well understood topic in some respects. You know, well, I think the primary advantage of being tested is if you're not sick enough to be put in a hospital, and if you are, then there's different care that's going to be given to you if you are COVID positive, is to allow you to avoid exposing other people to yourself. If you know you're positive, you can take steps to undertake what we call isolation. You're not around other people. If you're living with other people, you are staying in a part of the house where you can avoid exposing them. So it's prevention of transmission, either to people in the community that you don't know or to friends and family members that you do know. I would also say that once we have sufficiently scaled up our contact tracing team, we would also use the opportunity to talk to you about who you've been exposed to, so we can alert them that they could have been exposed. If they're sick, they really need to be tested, and likewise isolated. Case investigation and contact tracing is really one of the benchmarks of how we control a communicable disease. And you're being tested, and confirming that alerts us that we've got a chain of infection going on that we can try to take steps to respond to.
Thank you, Dr. Douglas. And if you are on this call and you have a question, you can press *3 on your telephone keypad to get into the queue to ask your question. Next, let's go to an online one. This is for Commissioner Thomas. And they're saying, as a 24-year-old resident of Highlands Ranch, I am less than happy about the drastic measure of leaving Tri-County Health and creating a new health department. Is there any room for discussion and or compromise? Please rethink this idea. COVID is an anomaly. Please step back, take another look at the situation, and maybe we can reach an amicable solution. Commissioner, go ahead.
Thank you. We are in conversations with Tri-County Health to continue to provide services for them. And let's remember that Tri-County Health is still providing service for all of our residents like they did a week ago and 50 years ago. And so nothing in that has changed. You still have a health department in place. We are interested in managing the Board of Health to be sure that those are representatives of you in Douglas County, and they are representing your interests. And that is really what our focus is going to be on. So nothing is really going to change as far as your services are delivered. It's just the direction to the health department director. That's part of the question that needs to be resolved. Thank you.
Wonderful. Thank you, Commissioner. This next question is for Commissioner Layton. They say, I would like to voice my unconditional support for TCHD's mask mandate. Masks work. The CDC said so, WHO says so, and other epidemiologists say so as well. So by opting out of the Tri-County mask mandate, Douglas County is implicitly indicating that masks are optional. How are you going to counter this impression?
Thank you, Erica, and I appreciate the question. I think it's a really important one. I stated it earlier, but I'll state it again. I strongly urge all of our citizens to wear a mask consistent with the science, the data, and the public health experts' recent recommendations, if not ongoing recommendations. Again, I wear a mask. My family wears a mask. I think you should too, and I strongly urge that. But the big distinction in Douglas County is I don't want to see you jailed or fined up to $1,000 if you're caught not wearing one. I think you've been through enough as Douglas County citizens over the last 4 months, whether it's job loss or externalities associated with the crisis. It's been a rough 2020 by all accounts. So adding to your burdens at this time, I don't think makes a whole lot of sense, especially when we're seeing up to 80% voluntary compliance with mask wearing in Douglas County already. Douglas County citizens have a wonderful reputation for having the healthiest county in the entire country. They are amazing citizens that do right by each other and by themselves. So I have every confidence in them, and I know our board does as well, to continue doing the right thing without us punishing them. They don't need that.
Wonderful. Thank you, Commissioner. We are now about halfway through our live town hall. We still have a number of questions to get to today, but we hope to also be able to hear from you if time allows. So again, to ask a question, you can press *3 on your phone. You can also send your question through the website at douglas.co.us/townhall. And remember, if your question isn't answered tonight, we invite you to go to douglas.co.us/citizenconnect to submit your comment or question. All right, let's go back to more of our questions here. This one is for Commissioner Thomas. They are asking, I am concerned with the decision of the commissioners to get rid of the Tri-County Health Department, but I'm wondering, will there be plans to replace the services of Tri-County? And I know you had already touched on that a little bit, Commissioner, but if you would like to just touch on that again, since it seems to be a hot topic.
Absolutely, Erica. We have received a lot of questions about this because people are, I think they think that we've abandoned them, and that's not at all what's going to happen. Tri-County will be providing services for the next year under the current arrangement that we paid $2.4 million for. And during that time, we will be working with Tri-County Health because state statutes are already very clear on what services need to be provided. And, let's just face it, Douglas County is the healthiest county in the country. And we do a great job of providing services for our citizens that they are able to use. We will continue to do that. And again, we are hoping that we can work some agreement out with Tri-County so those services will be provided. We just want to have more control over that Board of Health so that the needs of our citizens are being met by citizens from Douglas County on that original Board of Health.
Thank you, Commissioner. And we have one more question for you. He says, I agree with the no mandate for masks. We are responsible adults and we don't need the government to place mandates on us. I wear a mask out of respect for others. If you wanted to respond to his comment.
I'm sorry, who is that for?
That's for you, Commissioner.
I'm sorry, could you repeat that again? I'm sorry.
Thomas. He says, I agree with the no mandate for masks. We're responsible adults and we don't need the government to place mandates on us. He says, I wear a mask out of respect for others. And so it's more of a comment, but he would like your feedback.
That's a great point. That's a great comment that people are taking personal responsibility for themselves. And that's what we have asked all along, is they take responsibility for themselves and make choices. We've been listening to Dr. Douglas, the medical expert, all along. And Dr. Douglas has told us over and over that 80% is pretty good compliance, and that he's very concerned that if people are ordered to wear a mask, there's going to become an act of defiance. Some people just don't like government telling them what to do, right? And so he is asking that through education that people learn the importance of wearing masks and that they comply with it. So thank you for that.
Great, thank you, Commissioner. Our next one is for Commissioner Partridge, sort of along the same lines, but he says, I believe the Commissioner's decision to not mandate mask wearing and the reasoning described on the website is naive to think that people will actually do the right thing. What are your thoughts on that, Commissioner Partridge? Can you hear us, Commissioner?
Yep, sorry, mute. There we go. Thank you, Erica.
No worries. We can hear
Thank
you
you for that. No doubt a good observation, understand where you're coming from. But I will first point out that Douglas County is the healthiest county, not only in the state, but in the nation. That tells us right there that our citizens are responsible for themselves. That is very forward thinking in our citizens. We really appreciate that. The other thing I think we look at is certainly we know everybody has the ability to be self-responsible. We've seen that already. We've mentioned this before with that 75, 80% is where we've been consistently on mask use. To think that mandate could improve that has already, I think, from many, Governor, Dr. Douglas, ourselves, we don't feel that was going to change. Actually, I believe I've seen a few instances of increased mask use since the issue has been brought up. I don't think people want to be mandated, but they certainly understand what may be the right thing to do. And I want you to know, too, that the decision last week that we would opt out was not a decision to state that we do not believe there's efficacy in the uses of masks. There certainly is. Now, it's interesting, the science, and I come from a science background. You hear masks are good, masks are bad. Doggone it. We know you are following what is being suggested. In fact, I think the public can tell us what is suggested. Wash your hands, social distancing. If you're sick, stay home. If you feel vulnerable, stay home. Follow what you would think is the best for you to use a mask or not use a mask. And we are all respective. And I'm so impressed with our citizens in Douglas County. Even though I hear sometimes there's lack of civility, I think overall we have a very high level of civility in this county. And I know my fellow commissioners appreciate that too.
Great, thank you, Commissioner. And we do have a statement online here for you as well. It says, thank you very much for leaving the decision to wear or not wear a mask up to the local citizens and businesses here in Douglas County. I believe you made the right move in trusting the people to know what's good for us. Many of us are looking at statistical data and deciding when it's right to mask up. We appreciate this from all of you. Thanks again. All right, wonderful. Let's go to our next comment. This one is a question for Commissioner Layton. Commissioner Layton, he's asking, the CDC recommends wearing face masks, but yet the county commissioners are opting out of the Tri-County Health mask wearing mandate. The county commissioners now are trying to also remove Douglas County from Tri-County Health. I would like a detailed explanation of how both of these agenda items are keeping the citizens of Douglas County safe. Commissioner Layton, go ahead.
That's a wonderful question, and certainly part of the ongoing conversation that we've had as a board for many months, if not many years. You know, I've talked a little bit about the issue of mask wearing. Yes, we follow the data. Yes, we follow the science. Yes, we are listening to the experts on a daily basis, as we have been for 4 months since the day that the coronavirus crisis began. That said, again, just to reiterate, what will be best for our citizens is giving them the personal responsibility to make those personal health decisions for themselves. And right now they are doing that with 80% compliance. I am confident that our citizens will continue to do the right thing. Based on today's numbers, we really are in a position to continue with this particular trajectory. And we're cognizant of spikes and surges, and we appreciate Dr. Douglas informing us of that. There's a TCHD dashboard that we all review on a daily basis to monitor those surges. But as of today's date, we have 54 deaths in Douglas County. We mourn each and every one of those, and all are significant to us. The average age of death is 81. In other jurisdictions, there have been 352 deaths in Arapahoe County, 159 in Adams. In terms of hospitalizations, there have been 184 in Douglas County compared to 1,076 in Arapahoe County and 633 as of today's date in Adams County, with an average age in Douglas County of 63. And we value our seniors incredibly, and each and every life matters. The ages inform us a bit in terms of comparative data with regard to morbidity and pathology in other years where we don't have a global pandemic. And we know that seniors in particular are more susceptible to hospitalization and death as a result of coronavirus. This is a novel coronavirus, but it's still a coronavirus. So I think that's instructive, but we're continuing to monitor those surges. The other part of the question was with regard to exiting Tri-County Health. And I just want to reemphasize that we haven't. We are still with Tri-County Health. We'll continue to be with Tri-County Health. Our citizens will have a seamless experience in terms of where we're at right now, because nothing has changed, whether with cost or with personnel. So right now, all we've done is provide notice that we're looking to change within a year, and our staff will be exploring this in much more granular detail in terms of how to do it effectively. So thank you for that question, Erica.
Wonderful. Thank you, Commissioner. Our next question is for Commissioner Partridge. They say, most important question, how will this new health department cost the residents of Douglas County? Will you raise taxes on us? Where will the funding come from? When the city and the county is already facing significant budget shortfalls this year, shortfalls will only be worse and compounded next year. What infrastructure do you have that can be built upon to ensure that this happens smoothly and safely, and how is it even cost effective to do something like this? Go ahead, Commissioner.
Great. I really appreciate that because it gives us the ability to show who this board is and who we have been. I can tell you first what happened this year, and if any property owner in Douglas County did notice in their property taxes, you received a decrease from your Douglas County commissioners this year. That gives you an idea of who we are fiscally. And please know that we are very conscious of cost. We are one of the most effective counties. I think we probably are the most effective county in the state of the 10 large counties. Each one of the county employees serves the most citizens of any of the 10 large counties. That's because we certainly believe in efficiency. Our staff knows the people of Douglas County work hard, so they work hard for you too. And follow up on what we look at. Certainly, we are doing analysis of the services that are mandated, the services that are desired, the services that will provide the best public health for Douglas County residents. And as has been said over and again, we are continuing those services with Tri-County even today, and even up to roughly a year from now to July 11th was the day that we had to give for the final withdrawal. We're in the process of analyzing possible redundancy because we already provide emergency management, we provide mental health services, we provide human services. So we look at those cost savings possibility and redundancy. We also provide already 15 different departments and 8 other elected offices budgeting purposes. So no doubt we are experienced to run the government. We are one of the largest counties in the state that does not have its own health department. So we are looking to expand to be able to provide services for you. We already know we have excellent staff analyzing this, but we also have experts with Tri-County and other public health providers in the state, even around the country, that we will rely on. So please know we will analyze this fully. We have the ability to contract, and we do that all the time. So we make sure that the best services are provided for you, the Douglas County citizen.
Wonderful. Thank you, Commissioner. And thank you very much to Dr. Douglas, the Board of County Commissioners, and everyone who has joined us tonight. We do have some time to take a few more of your questions. First, we're going to go to an online question from Ellen, and this is for Commissioner Layton. And Ellen is asking, I agree with not mandating mask wearing, but what steps are being taken to encourage or recommend mask wearing in our county where there isn't a mandate?
Thank you for that question, Erica, and I appreciate that. You know, I'm really thankful for the hard work of our county staff and our communications and public affairs director, Wendy Holmes in particular, because the message is out. If you go to both the Tri-County Health website, and that's independent of us on some level in terms of their communications, and Becky O'Gwin does a phenomenal job, but that's well coordinated with Wendy Holmes and our communications staff. So there is an active messaging campaign around best practices when it comes to public health, and more to come. So stay tuned on that. Certainly, we want to reflect upon the guidance of experts and the guidance of Tri-County Health as we continue to share that messaging.
Okay, wonderful. Thank you. Let's go to a live question. We have Amy. Amy's in Highlands Ranch and has a question for Commissioner Thomas. Amy, go ahead.
Yes, can you guys hear me?
Hello? Yes, we can hear you.
Yes.
Great. Go ahead.
Okay. My question to Laura Thomas is, she had suggested that a mask mandate would hurt businesses, and I was wondering where that information is coming from. How do masks mandates hurt businesses?
So what I said in answer to an earlier question is that Dr. Douglas had told us in discussions before the Board of Health meeting that he was concerned about putting a mask mandate in place because we already had such high voluntary compliance, that he was concerned that if people were ordered to wear a mask, that people would become defiant and then not want to wear the mask. He also had indicated, as he said on the call today, that there was a shooting in Aurora over a mask. And he really was going to focus on education so that there weren't efforts of force involved that could backfire basically on people involved. And that came from Dr. Douglas.
Great, thank you, Commissioner. All right, next let's go to Ruby. Ruby's in Castle Rock. Go ahead and ask your question, Ruby.
Hello, I have a question about the board that will be selected to guide the decisions. I want to know what will be the composition then of this board. And the reason I'm asking the question is that when I read about the decision that was made, the votes that were taken were, I realized there was only one MD on the board, but there were other highly educated people. There were nurse practitioners, there was someone who had a master's in public health, and so I realized they weren't all MDs making that decision, but they certainly are people who understand viruses, infections, and community health. So are you saying that we are going to have a board of whom? I just want to know who is going to guide our health in Douglas County.
And I'll be happy to take that question.
Great, go ahead. Thank you, Commissioner.
Commissioner Partridge, I'll be happy to take that since my background is in health science. So, Ruby, very good concern. And first of all, we understand we sit on numerous boards and commissions ourselves, not just being county commissioners. And we all know it takes many experts to be able to provide a very good and adequate board. And I will just mention one of the criticisms I have from a decision last week. I did not hear the question that was asked. What would be the financial and the enforcement demand put on each county if we put a mandatory mask mandate on? That was not asked by the board. I really believe that was a failure of that board to represent all citizens of Douglas, Arapahoe, and Adams. So the board makeup will certainly be what we know as experience. We will reach out to numerous. There's going to be some state guidelines on that. No doubt medical people are one of the most important things on health. But as we know, all of us are experts in our own health. And again, Douglas County has proved that, being the healthiest county in the country. So please know we will do a good, thorough, full process to analyze what will provide for the best public health board for Douglas County residents.
Thank you so much, Commissioner. Let's go to an online question from Carol. This is for Commissioner Thomas. Carol says, please tell us where we can find the data to back up this decision, including public open comment results, feasibility study, cost analysis, and funding source. If it does not exist, as I've been told, then how could the decision be made without it? Go ahead, Commissioner.
Thank you. And Carol, I have read the email that you've submitted to us as well. So we're working on that answer. We don't have any feasibility study that was done. And I would like to add that the revenues are not down for Douglas County. We just got our revenue report from May of this year. And when we compare the revenues from last year to this year, from January through May, we actually are up 5% on our revenue. So I just wanted to use this opportunity to clarify that. And this goes back to the decision made by the Board of Health at Tri-County that they did not follow the recommendations of Dr. Douglas, and they imposed positions on our citizens in Douglas County that weren't necessary. And if they did that now, what are they willing to do in the future? And this decision was made to protect the rights and the freedoms and the livelihoods of citizens in Douglas County going forward. Thank you.
Great. Thank you so much, Commissioner. And just a final reminder, if your question wasn't answered tonight, we encourage you to visit douglas.co.us/citizenconnect to submit your question or comment. And be sure to join us again next time for additional updates. Before we conclude our live town hall, we'd like to give your Douglas County Commissioners a few moments for final comments. Commissioner Partridge, let's hear from you first.
Erica, thank you first for moderating. I also want to thank the wonderful Dr. Douglas. So it is certainly a pleasure to be able to work with such an expert. And Tri-County Health, Dr. Douglas, Jennifer Lugwood, all the staff has been wonderful helping us get the variances that we have received, and again, to provide some of the best public health services that are available. I also want to thank the callers, all those who have corresponded with us. It really is the engagement of the public is one of the best things that we like to hear, because it really keeps us on the top of our game. Make sure that we are providing a government that is for the people and by the people, no doubt. So please understand, we are doing everything we can to be informed, being educated. One of our jobs is to ask the questions. We do a lot of that so that we are provided the best information to make the best decisions for you. So I really thank everyone to be involved, continue to be engaged, and wash your hands, keep your distance, respect everyone else, and please, if you feel vulnerable, stay home, stay healthy, and take care of yourself. God bless you all.
Wonderful, thank you. And now let's hear from Commissioner Abe Layton. Abe, go ahead.
Thank you very much, Erica. I just would like to share one of the mottos of this Board of County Commissioners, and it's been on our website and is pretty upfront and personal to me. It's that citizen engagement is the heartbeat of effective local government. You know, this is our 17th live town hall, and the opportunity to engage with our citizens is absolutely critical to each of us. We always say we work for you, not the other way around. So whether you agree, disagree, maybe you have questions, we're here to serve. So continue to engage with us, because we're here and we're listening. And again, I want to reiterate my thanks to Tri-County Health. I didn't mention Jennifer Lugwig, and I want to make sure I thank her as well. She has just been phenomenal, in addition to Melissa and John and everyone else. So a huge thanks to our citizens, to Tri-County Health, and my board. This is a group that has worked well together, and I'm really thankful and honored to be serving with both of them. Thank you all. Have a great night.
Thank you, Commissioner Layton. And now let's hear from Commissioner Laura Thomas. Go ahead.
Thank you. I would like to thank all the citizens who have taken the time and effort to reach out to us in the last week to share with us their positions on many of these issues that we've been talking about tonight. When someone runs for county commissioner, they do that because we've done that because we care about our community. Abe has come to us with a law background, but many hours of volunteering on boards and doing volunteer work. Roger has spent his life in medicine, helping other people feel better and helping them. I spent 26 years with the Colorado State Patrol, so I care deeply about public safety. And safety is what we believe in, and as well as protecting our rights and our freedoms. And that is why we've made these decisions that we have. And we'd like to thank you for calling in and listening to the answers. We encourage you to remain engaged with us and work with us as we create a new public health department for Douglas County, just like we have done with our judicial district. Good night, everybody, and God bless all of you. Bye-bye.
Thank you, Commissioner Thomas. And thank you to all the commissioners and on behalf of Douglas County and the Tri-County Health Department. Thank you. Thank you for sharing your time with us. We hope you will join us again for future town halls. Be well, be blessed, and good night.